How do you tell if someone has diabetes? Is it visible to the naked eye? How severe can this disease become? What first comes to mind when you think about diabetes?
Sugar, food insecurity,
unhealthy body,
pain that the people that are diagnosed go through and their families.
What lifestyle choices contribute to diabetes?
How does diabetes lead to chronic pain?
How are drugs developed to treat chronic pain?
Diabetes remains the 7th leading cause of death in the United States in 2010, with 69,000 death certificates listing it as the underlying cause of death, and a total of 240,000 death certificates listing diabetes as an underlying or contributing cause of death. This image shows a vast increase in number of cases over the course of 9 years. The upward correlation is dangerously increasing over time.
Diabetes can be classified into two types, type 1 and type 2. Type 1 diabetes is where the pancreas does not produce any insulin, thus leading to irregular blood sugar levels. Insulin is a hormone produced by the pancreas that allows sugar to enter the fat or muscle cells, which are used as energy. Type 2 diabetes is where the fat cells resist the effects of insulin, which affects the way the body processes blood sugar levels. These two types of diabetes have similar symptoms such as blurry vision, weakness, excessive thirst, hunger, and weight gain, weight loss, and damage to the vital organs. One's diet and everyday activity impacts the way one can develop type 2 diabetes. It is difficult to define what contributes to type 1 diabetes since majority of cases involves genetics or unnoticed progressions. But type 2 diabetes mainly involves individuals developing diabetes by the lack of healthy foods and exercise. So what is being said is that type 2 diabetes can be avoided by having a balanced diet and exercise.
Before the 1920s, an effective treatment for diabetes didn't even exist. Type 1 diabetes was actually considered fatal. An effective treatment for diabetes wasn't found until the discovery of a hormone that lowered glucose levels. This hormone is known as insulin and was found in pancreas extracts from dogs. After this discovery and seeing effective results, much effort was put into purifying this treatment for human use. This began a series of trials that would go to bettering the lives of diabetic patients. But what about other symptoms, such as chronic pain and diabetic neuropathy?
Neurons are very sensitive cells that rely on concentration gradients inside and outside the cell in order to transmit signal from one to another. As a result, any fluctuation in these concentration gradients, for example in diabetic patients, the concentration of glucose in the blood, can lead to disturbances within these cells. When these disturbances get extended for a long period of time, they can lead to nerve damage, and the medical term for that is called diabetic neuropathy. When that nerve damage takes place, it can eventually lead to pain, and because some nerve damage can be permanent, when this pain gets extended for a long period of time, it becomes classified as chronic pain. From prior research, we know that certain proteins have to bind to calcium channels in order for them to be activated. As a result, if we can inhibit that binding, or we can find a molecule that can inhibit that binding, we can therefore reduce chronic pain. Quantifying these amounts of proteins can be an indicator of whether or not they have or haven't bound to calcium channels. This can therefore tell us whether a molecule is good at inhibiting the binding between certain proteins and calcium channels, and therefore whether it can efficiently be developed into a drug that can be used to treat chronic pain.
Another technique used in developing treatment for diabetic neuropathy is calcium imaging. Calcium imaging uses a microscope to capture fluorescent images. This technique analyzes the role of calcium ion channels within functioning neurons and their direct correlation to the sensation of pain. This technique is called calcium imaging because it is the calcium influx that is being analyzed. This will reveal whether a drug is inhibiting or causing pain. Why is this important? It allows researchers to prove a compound's efficacy. If a drug is able to inhibit calcium influx, it inhibits the neuron's ability to transmit pain signals. It is not the diabetes itself that is being treated, but rather its symptoms. With no cure, it's only practical that a patient be unable to cope with the pain associated with their illness.
What are some prevention methods?
Is it possible to target specific cells in the pancreas to prevent disease?
And finally, does society hold a strong influence over the lifestyle choices that we make that can lead to diabetes?